The purpose of today's event is to give you some information on healthcare. We all know that since the ACA and Obamacare and our exchanges, our healthcare has changed dramatically in how we go about purchasing and quality, and generally how it's affecting our lives financially. And we put together a panel of real experts today who are going to touch on all those areas. And we're also going to be able to give you some information on what we can actually do to actually get government out of our lives in healthcare. One of the things I want to start talking about today is an overview on Initiative 20. Does anybody not know what Initiative 20 is? It's okay. Initiative 20, it's called Colorado Care. It's on the ballot for 2016, and it's single-payer healthcare in Colorado. If you're not familiar with single-payer healthcare, it's full government control, full government pay, which means you pay for all of this. And that's on the ballot for 2016. They got the signatures last week. And they got the signatures, and what they're going to do for the presentation is, I think, is a grand deception. They're going to call this an opt-out of Obamacare. And that's how they got a lot of the signatures. They walked up to people and said, "You want to opt out?" And they said, "Sure, sign me up." But it's not an opt-out. It's an opt-in to Obamacare on steroids. Section 1332 is what they're going to say, gives them the opportunity for Colorado to get out of Obamacare, but 1332 says specifically that the states can do that providing they do what Obamacare does or more. So it's a deception. And that's how they're going to sell it. In fact, they've hired somebody from NPR, a propaganda specialist, who is going to launch a campaign in Colorado to convince your neighbors that they should vote for this, that it's good for them. When obviously we're going to find out it's not. Well, some of the things they say it's fiscally responsible. It's $26 billion what this could cost. Want to take a guess on what the state budget is? $26 billion. So you have double cost off the bat, their numbers, annually. This is going to be managed by 21 people. Not your state legislatures. They're out of the business. Every dime, federal and state, for health care goes into what they're going to call Colorado Care. And these 21 czars are going to make all decisions. In fact, they're going to make the decisions on how much you're going to pay for this, because you're up front going to get a 10% tax increase to start. That board is able to raise taxes unencumbered by Tabor because they've written it out, or as much as they need to make this thing solvent. At $26 billion, it's not solvent. But at $26 billion, you can do the math, what's going to cost you personally and your families. They're going to say that this is free from government and politics. That's from the website. It's 100% taxpayer funded. You are paying for it, so it's 100% government. In fact, in the write-up, it says this is the government agency. But they're going to look at you right in the eye and say it's free from government and politics. It's affordable and fair. $26 billion. No burden on Colorado families. If you're a Colorado family member, it's a 3% tax to start. If you're a business owner, it's 6%, so that's 10% just to start. Patients make treatment decisions. We know from Obamacare that's not true. We know a state-run agency is not going to be able to do that. They can't do it. And they're using the healthcare co-ops as a model for how this is going to work. The healthcare co-ops all across the country are failing. Colorado's biggest co-op crashed 2 weeks ago, throwing out 80,000 families into the street with no healthcare. Now that was lower end costs on their policies, so it's doubtful those families are going to be able to afford higher costs that they're going to be forced into. But there's also ways to get around this. We're going to present some things today to get government out of your life and healthcare, so we don't have to go down this road. This is full socialist healthcare, and I say that not in a joke because Bernie Sanders was here. And Bernie Sanders is a socialist, and he loves this program. They were happy to put that on the website. One of the experts they say is, they're happy to say this is a good idea, is the architect from Vermont's single-payer health care initiative. That crashed before it even got off the ground. They were going a different route. They had the votes in the House and the Senate, and the governor was going to sign it. It was going to be law, but they looked at the cost and scrapped the whole thing. It was far less than our $26 billion. So he's here now saying, yeah, good idea, you guys can do it. And it's also part of the Socialist Party USA platform for 2015, just in case someone has any doubts that that's what it is. The people behind it are State Senator Aguilar, who's a nice woman, if you've ever met her. However, she's definitely wrong. So we're going to work with you, because how can we actually beat this? Somebody asked me today. You are going to beat this. They're going to have millions of dollars in ad campaigns saying that we should vote for this. We don't have millions of dollars, but we have you. So we want you to take those flyers you have. We want you to take those home. We want you to give those to people. And we want you to talk about this. We want you to go in November, have 20 people with you to go vote, and vote no on mission.